Sexual violence and intimate partner violence are global problems, causing immense harm, suffering, loss of dignity, and immediate and long-lasting medical and psychological consequences. Sexual and gender-based violence can happen with anyone. However, women, adolescents, and children are at higher risk of sexual violence. Sex workers, trans people, pregnant women may be more vulnerable to sexual violence and lack of care thereafter. In India, according to the National Family Health Survey 5 or NFHS 5, 6 in 100 women aged 18 to 49 experienced sexual violence, while 31 in 100 women experienced intimate partner violence. Sexual violence and intimate partner violence have health consequences on survivors, like unwanted pregnancy, sexually transmitted infections including HIV, injuries, unsafe abortions, chronic pelvic inflammatory diseases, among others. Besides this, survivors suffer psychological consequences like anxiety, depression, and risk of suicide. And on top of this, the social consequences of blame, judgment, and gossip contribute to isolation, which makes it more difficult for survivor to speak up or look for medical care. Yet, in India, only 23 in 100 women who have experienced sexual or physical violence did tell someone, according to NFHS 5, and only 2 among them sought medical help. So what makes survivors of rape, sexual violence, and intimate partner violence not seek medical care? MSF conducted a mixed method KAP, Knowledge, Attitude and Practice study to understand barriers of care for survivors of sexual and gender-based violence in Jahangirpuri, Delhi. MSF operates a 24-hour clinic for survivors of sexual and gender-based violence, providing comprehensive medical and mental health care, free of cost, in Jahangirpuri. The study used a multi-phase, sequential mixed method designs, where 1,257 participants from general public responded to a questionnaire and 93 people participated in qualitative interviews. Study sample was representative of the Jahangirpuri population. We hereby present the perceived pathway of seeking care for a survivor and perceived barriers in the pathway. To begin with, people perceived female children, adolescent girls, women and young boys to be at risk of rape and sexual violence. However, it is important to note that anyone, including people from LGBTQ community, can be at risk of rape and sexual violence. Most participants commonly perceived physical injuries, mental distress, and death as consequence of sexual violence, while only some perceived the more common consequences like unwanted pregnancy, unsafe abortion, and sexually transmitted infections. However, in reality, physical injuries are not common presentation and death is a rare event. Most participants believed that survivors need help and care, mostly for treatment of wounds and legal support. However, participants thought that most of the survivors would remain silent and not seek any help because of lack of knowledge about why, where, and how to seek help or medical care, fear of perpetrator, shame, and guilt. The participants also thought that a small minority of survivors may disclose the incident to a close confidant within family or to a close friend. And the support of this trusted person was described critical for the survivor to access formal care. If rape was disclosed to a close family member, participants thought that this may lead to broader family discussion on what action to take. They would discuss various social consequences and the gossip, judgment, and blame that would stigmatize the family. Lack of privacy and confidentiality, notably loss of reputation, was directly equated with destroyed future, affecting survivors' marriage prospect, current marriage, or education and career opportunities. Participants thought that the family feared that seeking medical care would lead to police reporting, which would make the matter public. And the fear, with lack of trust in the police to respond to sexual violence effectively, non-judgmentally and confidently, was quite low among the participants. Also, participants highlighted poor treatment of survivor by the healthcare worker and lack of confidentiality are key barriers to seek care. So, if they remain silent, they will have to face various consequences as highlighted before. Despite these challenges, 2 in 100 of survivors who did tell someone sought for medical help. So what options do they perceive? Most participant survivors will seek care in government hospital due to free-of-cost healthcare. However, the participants also perceive that they face several barriers in accessing help in a government hospital, including mandatory police reporting, fear of forensic procedures, fear of undignified treatment by healthcare worker, long waiting times in hospitals, and lack of confidentiality and privacy and low quality of treatment. Owing to these challenges, some might consider private care as it was perceived to be confidential, did not require police report, had shorter waiting times, and offered high-quality care. The barrier at private medical care is the high cost, which was perceived as guaranteeing confidentiality by many participants. Considering the barriers at government and private hospitals, those survivors not managing to seek care would resort to seek medical care from informal medical services, which has potential risk of wrong diagnosis, spurious treatment or medication, and unsafe abortion. In summary, our findings suggest that most survivors would not seek help, but would remain silent due to the social consequences and perceived barriers to access formal care and barriers within formal care system. Based on the study, MSF recommends that health services for survivors need to be well known in the community, easily accessible and free of cost. It should be comprehensive with quality medical and mental health care. It should not involve the police and should be based on survivor-centered principles. Overall, healthcare to survivor of rape and sexual violence should be based on survivor-centered principles such as privacy, confidentiality, informed consent, autonomy, respect, and non-discrimination. This will require policy change to ensure supportive community and media environment, increased awareness of community to know why and where to seek help or medical care, survivor-centered, quality medical care provided by trained healthcare staff who provides care without requesting police reporting first. These recommendations can improve survivors' access to care, supporting them to heal and recover.